So it is my pleasure now to welcome Dr. Stephen Brooks, and his talk is Only the Lucky Survive Cardiac Arrest.
Do you ever just stop and marvel at your own heart? You depend on it every second of every day, but I feel like sometimes we take it for granted. This biologic machine has started working from before you were born and continues right now, and actually it's keeping you alive while you're listening to me speak. I'm more aware of my heart right now because it's beating about twice as fast as yours. The human heart is about the size of a fist and weighs 290 grams, and it sits here on the left side of your chest. It's working mostly unnoticed 24 hours a day. The human heart pumps about 5.5 liters of blood every minute, which works out to be about 8,000 liters a day. And most of the time, it works like clockwork, working uninterrupted for about 2.5 billion cycles over the course of an average human lifespan. But sometimes things can go wrong. I want to tell you a story about a man named Chester Babcock, or Chet, as his friends and family like to call him. On a day just like today, a few years ago, Chet showed up at the Invista Arena complex in Kingston, and he was going to play some recreational hockey with his friends. He got into the change room and he laced up his skates and he got out onto the ice and did a couple laps to warm up. He felt great. The cold, fresh air of the arena on his face and the smooth, clean glide of freshly Zamboni'd ice under his skates. And the game started like any other. A couple of sprints into the corner to pick up a loose puck, and then a beautiful wrist shot right into the top corner for a goal. But at the end of one of his shifts, on the way back to the bench, something profound and unexpected happened to Chet. His heart, without any warning, developed a disorganized and chaotic rhythm, something called ventricular fibrillation. And because of that abnormal rhythm, the heart stopped pumping blood efficiently. And within seconds, Chet was unconscious. And he collapsed onto the ice. From the bench, his teammates could tell that he was unnaturally still. And it didn't take them too long to figure out that something was horribly wrong. One of his teammates raced to his side, got down on his knees, and discovered that Chet was completely unconscious and not breathing. Chet was experiencing something called sudden cardiac arrest. This is a time-sensitive, life-threatening emergency, and you might be surprised to know that it happens 100 times a day in Canada and 1,000 times a day in the United States. My research work is about what happens next, the community response to cardiac arrest. Chet was lucky that night because 2 of his teammates had been trained in CPR, and they recognized he was in cardiac arrest. So as 911 was being called, they started CPR, and someone else went into the lobby of the arena to get the public access defibrillator. And like all automated external defibrillators, when they turned this one on, it gave his teammates loud and clear verbal instructions on what to do. And this included taking the 2 sticky electrode pads and putting them here and here on Chet. And when they did that, the machine detected the abnormal electrical rhythm. It charged up and it delivered a small electrical shock to his heart, and it fixed the abnormal rhythm. And because the rhythm was fixed, his heart started beating again. And it was at that moment that his teammates on the ice could hear the wail of the ambulance sirens coming into the arena parking lot, roughly 13 minutes after the 911 call. Chet was taken to the hospital, where he eventually regained consciousness. And because of the quick actions of his teammates that night and the amazing care provided by the paramedics, firefighters, and all the staff at Kingston Health Sciences Center, Chet went on to make a full recovery. So I'd like you all to join me in offering a warm welcome to Chet and his wife Sandy, who are here today. Unfortunately, Chet's amazing story of survival is not the norm. Less than 10% of people who experience cardiac arrest survive. One of the main reasons why this survival rate is so low is because less than 50% of people who experience this get bystander CPR. And amazingly, less than 3% get the advantage of a public access defibrillator. Unfortunately, in the context of cardiac arrest, calling 911 and waiting for the professionals is not good enough. So as a scientist, I ask myself, to survive cardiac arrest, you have to be lucky. You have to be lucky enough that someone witnesses your cardiac arrest and recognizes it. You have to be lucky enough that someone who sees you is willing and able to do CPR. And you have to be lucky enough that you have your cardiac arrest within reach of a public access defibrillator. Now, I don't know about you, but I don't like leaving luck to determine something that's so important. I'm too uptight. And so I wonder sometimes whether, if I had a cardiac arrest, whether anybody would do CPR on me. Now, this room is full of my paramedic colleagues, and my wife is even here, but I'm not entirely certain that I would get chest compressions if I had my cardiac arrest right now, because I've burned a lot of bridges recently. But my work as a scientist, I asked the question, how can we take luck out of the survival equation? How can we make bystander CPR and AED use a more purposeful part of our plan when cardiac arrest happens in our neighborhoods? And so tonight, I'm going to tell you about 3 projects which aim to do just that. The first project is something called the PulsePoint mobile device app clinical trial. The PulsePoint system was invented by a fire chief after an unfortunate missed opportunity to save a life. His name was Richard Price, and he was having a lunch in San Ramon, California, which is his hometown, just outside of San Francisco in California. He and his colleagues, who were all firefighters, were having lunch in a restaurant, and in the restaurant immediately adjacent to theirs, a gentleman experienced a sudden cardiac arrest. Richard and his firefighter colleagues had no idea that anything was wrong until they saw the paramedics from their own station responding to an emergency and pulling up right outside the restaurant. Unfortunately, this man wasn't as lucky as Chet, because nobody in the restaurant knew CPR, and there was no public access defibrillator available. And unfortunately, this person didn't survive. As you can imagine, Richard and his colleagues were absolutely devastated. There they were, enjoying a nice lunch together, all firefighters, and literally on the other side of a piece of drywall, this tragedy was unfolding. All of them, of course, capable CPR providers, and one of the gentlemen even had a defibrillator in his truck steps away. So if they had only been made aware of the emergency, things might have been completely different. So as the legend goes, Richard and his friends began jotting down the fundamental principles behind the PulsePoint mobile device app that very afternoon on the back of a napkin. And today, PulsePoint is a reality. In PulsePoint-enabled communities, people who are willing and able to do CPR are encouraged to download the app on their phone. And the app essentially links them with 911. Think of it like Uber for basic life support. When a cardiac arrest emergency occurs in one of these communities, the 911 center becomes aware of the address, and the PulsePoint system automatically notifies any users of the PulsePoint app within 400 meters of that emergency location. And it sends them a loud notification and then provides them with a map showing the location of the cardiac arrest and any nearby public access defibrillators. So it gives people an opportunity to respond and start basic life support while paramedics are on the way. So when I first heard about this idea in 2010, I was amazed. Something so elegant and beautiful. On a whim, I booked plane tickets, literally that afternoon, and I flew down to California the next week to meet Richard in his office. I wanted to hear more about the app, and most importantly, I wanted to bring it back to Canada. Little did I know it would take me 5 years to do that, a lot of red tape, but I did it, and I'm very proud to say that Kingston was the very first community outside of the United States to implement PulsePoint, where it's active today. And that acted like an icebreaker for Canada, because we then took it to British Columbia, and we implemented it in the entire province of British Columbia. We moved on to Winnipeg and implemented it there. And then we joined forces with our colleagues in Columbus, Ohio, where the app was already active. And together with the Canadian sites, we implemented this clinical trial, which is still recruiting patients today. This trial will inform the global 911 community about the effectiveness of this kind of strategy. We're essentially going to measure the effect of this PulsePoint mobile device app in a community on bystander CPR rates, the use of an AED, and overall survival of cardiac arrest patients in these neighborhoods. There were a few limitations of the original configuration of the app. The most important one was that PulsePoint users were anonymous. And because of that, it was thought to be a little too risky to ask them to respond to private residential location cardiac arrests. The major problem with that is that more than 70% of cardiac arrests that occur outside of a hospital happen in a home. So this strategy was missing a major part of that. The second issue was that most citizens with this on their phone were not carrying around defibrillators. And public access defibrillators are fairly sparse. So the strategy wasn't really engaging defibrillators and getting people shocked earlier. So the second project I'm going to tell you about addressed these shortcomings in a slightly different way. And this program I learned about in Scotland. In 2018, my family and I had the great privilege of moving to Scotland and living there while I worked as a visiting professor at the University of Edinburgh. We learned some fantastic things in Scotland. The kindness of the Scottish people. I learned how to taste single malt. I learned how to find the best fish and chips. I learned how to eat haggis and keep it down. But the most important thing that I learned while I was there was about something called a community volunteer responder program for cardiac arrest. And this program was developed in the countryside and villages around Aberdeen, Scotland. The communities that were targeted were areas where ambulance response times were longer than the average because of their rural, out-of-the-way location. And what they did was they targeted those places and recruited volunteers, the citizens themselves from those communities, and they trained them in CPR. They equipped them with a uniform and some basic medical equipment, and they equipped them with a defibrillator. And through a different kind of app on their phone, they were dispatched at the same time as the paramedics to cardiac arrest emergencies in their community, to both public settings and residential home private settings. And because the volunteers were embedded within the target communities, they were often closer to the nearest responding paramedic unit. And with this strategy, they were able to shave off 5 minutes from the average response time in the region. Now, 5 minutes might not sound all that much, but in the context of cardiac arrest, that can be the difference between life and death for someone. So again, I saw this strategy and I couldn't stop thinking about getting it back to Canada. Many years later, it happened. And I'm very proud to announce that the Frontenac Paramedic Service, Neighbors Saving Neighbors Community Responder Program is about to launch. And by the time this video is online, I'm hoping that we're actively recruiting volunteers in our region and they're going to respond in the same way that the Scottish volunteers did, responding simultaneously to cardiac arrest emergencies in our region to cut down that delay to treatment. We're going to try and recruit 250 people, which sounds like a lot. But we need your help to do that. So if you're watching this video at home, if you're in the room and you live or work in Frontenac County, above the 401 or on the Frontenac Islands, please go to engagefrontenac.ca and look for the Frontenac County tab and find out more about the Neighbors Saving Neighbors program, and please consider volunteering. And don't worry if you don't have any medical training or you've never thought about CPR before. If you're interested in maybe saving your neighbor's life, we will train you in how to do high quality CPR. We'll equip you with some medical equipment that's very basic, and we'll give you a defibrillator. And we'll teach you how to respond safely in your community when you're called upon through an app on your phone. So this is a pilot project, and so my research team at Queen's is going to collect information about every incident that involves a volunteer, and it will involve the medical information about the cardiac arrest, but we're also going to be gathering information from the volunteers themselves, the paramedics involved in the response with the volunteers, and the family members and the bystanders on the scene to get a holistic view of how the program is working. And we hope that this will be a springboard. So we're going to optimize the program here locally, and then we're going to be looking for more funding and other communities interested in implementing the program, and we're going to be looking for partners to help us scale up across the country. We know that if we can shave even just a few minutes off the response time in these communities, this program will save lives. So the third project I want to tell you about involves a revolutionary piece of technology. And it was developed by a company called Rapid Response Revival based in Sydney, Australia. I'm the chief medical officer for the company, and full disclosure, I'm invested in the company as well. Conventional defibrillators like this one over here can cost anywhere between $1,000 and $4,000 and weigh up to 3 kilograms. Some of them are the size of a small toaster, like that one. It might even make toast, I'm not quite sure. I haven't tried. But the device that I'm going to talk to you about is different than a conventional defibrillator in those ways. Steve Jobs changed our world by introducing us to the iPod with the famous line, 1,000 songs in your pocket. Well, tonight I'm hoping to one-up Steve Jobs by introducing you to something called the Cell Aid, which is the power to save a life in your pocket. So this is the Cell Aid. It's spelled CELLAED. And this is the world's first personal defibrillator. And it's ultra portable, as you can see. It's a little bit bigger than an awkward cell phone. This device was not invented by a conventional AED company, but rather the husband of a cardiac arrest survivor and his engineering friend. It weighs 290 grams, which interestingly is the same weight as a human heart. And it will cost less than a tenth of a conventional automated external defibrillator. Although it's not available for sale in North America yet, it has regulatory approval to sell in more than 70 countries around the world. The device design is really interesting. It snaps in half to activate it, and the two parts of the device, the two halves, act as the electrode pads and go on the chest. I think that Cell Aid could do for cardiac arrest safety what smoke detectors and fire extinguishers did for fire safety in the 1980s. I think that Cell Aid is going to give us an opportunity to reconsider our standards of safety in the home and the workplace so that, like a fire extinguisher, we will always have a defibrillator within reach. I think that Cell Aid and other technologies like it might change the paradigm from public access defibrillation to personal access defibrillation. And maybe public access defibrillators will go the way of the public telephone booth. Imagine if the nearly 1 million PulsePoint users in North America also had a Cell Aid in their bag. Imagine if, because it's that much more affordable, we could equip all of our Neighbors Saving Neighbors with a defibrillator. Imagine if we could have one on each floor of a condominium, or maybe even one in each home. or in the kit bag of each sports team coach. I think the opportunities to improve access to early defibrillation with technology like this are limitless. Working in cardiac arrest resuscitation can sometimes be a little frustrating because of that terribly high mortality rate that just seems to be stuck there sometimes. And not to speak of the incredible barriers and challenges when we try to implement new programs or strategies in the community. That's tough work. But I remain inspired by the knowledge that we have the tools to save lives. We know what it is. It's CPR and it's early defibrillation. And our challenge is to create new ways of making those things happen more consistently when cardiac arrest occurs in our neighborhoods. And it only takes one inspirational survivor story like Chet's to remind you that even if we save one life, that can profoundly affect the life trajectory of that person, but also of their family and the community around them. So I will continue to work on this problem with my amazing team here at Queen's, alongside a global community of resuscitation scientists and advocates who are working every day to try and take luck out of the survival equation for cardiac arrest. Thank you very much.